Hello everyone. On Wednesday, I joined Windsor Mayor Drew Dilkins and our Medical Officer of Health, Dr. Wajid Ahmed, to discuss local conditions as the result of COVID-19. All of Essex County mayors were in attendance in full support of the health unit and following public health guidelines to stop the spread of COVID-19. We knew all along cooler temperatures of autumn might well coincide with the second wave of COVID-19, and unfortunately, our worst fears have come true. Cases are surging here and across the province and country. Over the last 7 days, Windsor Essex has witnessed new cases in the double digits. There are now 11 people in hospital, 2 of them in ICU. 4 long-term care facilities are in outbreak status. Hotel Dieu has restricted visitation, and another member of our community was lost to the virus. The number of cases of local community spread are increasing. I understand that it has been a long 8 months of restrictions and regulations, and that many are feeling pandemic fatigue. However, we need to act resolutely and without delay as individuals and as a community to slow the spread of COVID-19 and keep it from overwhelming our healthcare system and further infiltrating our long-term care homes, where it could have a devastating impact on our most vulnerable residents. We need to protect ourselves and each other. It's difficult to remember the fear and uncertainty that gripped us all when this pandemic began this spring. But we need to recall how we felt and how we reacted. Windsor Essex was hit hard in the spring and was the last region to move into stage 3. The situation in Ontario is just as grim now as it was then, and it's poised to get worse before it gets better. Community spread is rising. Several healthcare workers have become ill, and our most vulnerable people are suffering. Our public health team has advised that we could see 6,000 cases a day in Ontario within the next 2 to 3 weeks. Think about this, 6,000 in the next 2 to 3 weeks. 6,000 cases if we don't revert to the safety measures recommended now. With Ontario's new regulations, we are at the moment yellow protect zone. But with numbers rising, we are moving towards orange. Yellow means that no more than 10 people indoors or 25 people outdoors for gatherings. Organized public events are limited to 50 indoors and 100 outdoors. Religious services are limited to 30% capacity. Face coverings are required indoors, workplaces, and indoor public places. The town is working with the health unit, our own bylaw officer, and the OPP for enforcement on current issues. The stories out of the Greater Toronto and Ottawa areas of those flouting the rules are frightening. Renting storage facilities for parties, lighting off fireworks in parking lots, great gatherings of people at private homes, to name a few. Here in Essex County, we've had 3 investigations of breach of gathering rules, including one at the university, and we cannot let this escalate any further. The key difference between now and the spring is that we know much more about COVID-19, and we've taken significant steps to secure sectors where it is likely to spread. The federal and provincial governments have provided additional support to municipalities, education, long-term care, and healthcare facilities to increase the COVID-19 resilience. They have provided funding to businesses to assist with rent, worker support, and PPEs. The federal government is also diligently working on procuring quantities of vaccine as well as means to distribute it. There is hope that vaccination will begin later in 2021. The Ontario government, in partnership with agribusiness, announced this week a comprehensive strategy to protect agricultural workers and the province's food supply chain. This three-pillared strategy will work to keep our farms in business and our workers in our communities safe. It is a very welcome development. While all of these sectorial supports are important, a lot of responsibility still boils down to individual choices that we can make now and today. One of them is wear a mask, wash your hands, sanitize frequently, touch surfaces, keep your distance, stay away from crowded areas, and stay home if you are sick. We have the power as individuals and the responsibility to keep our community safe. And I'm imploring every resident of Tecumseh and Essex County to use that power to protect yourselves and each other. Here at the town, we are doing our part. We are limiting people in our public facilities and cleaning frequently touched surfaces. Staff wear a mask unless at their desks. Meetings are held online. Some staff are working from home to limit the number of people in the building, and council meetings are live streamed. Staff and the public are screened before their shift or entering town hall or the arena. These are all important measures. And we have had to cancel activities and events this year, including our annual Christmas in Tecumseh and Santa Claus Parade. On a brighter note, recreation staff has put together a number of activities that can be done remotely and in person with limited attendees. Our first virtual visit with Santa is this Saturday. To view what we have available and to see how you can participate, visit our website. This year we are holding a Holiday Lights event, and we are asking property owners to decorate their house and yards with a chance to win one of 10 holiday prizes. Register with the town to be entered to win. Visit our website for a map of decorated streets to tour by foot, bike, or car. That should lift all of our spirits. It is very likely that Christmas will look very different in our homes this year as well. Social gathering is likely to be limited to those in your households. This may be very hard on our mental and emotional health and well-being, on top of usual effects felt during the darker, colder winter months. I want to remind you that there are a number of community supports available to you and anyone you know who is suffering. Our local branch of the Canadian Mental Health Association has a wealth of programs aimed at supporting our community. Some of these include counseling support, a 24-hour urgent care facility, seniors outreach calls, and help with accessing local programs and services like food banks and financial support. All of this information is posted on our website, and you can also call 211 for assistance. I ask that everyone think of those around you, friends, family, neighbors, and co-workers, and assist them with reaching out for help. We are truly all in this together, and we can help each other through this time. Together, we can make a difference. Thank you for listening today, and I wish you well, and I ask you to all stay safe.